support the library and the Alzheimer's Association tonight. Thank you to our home audience too. If you have questions, if you're able to leave them till towards the end, that would be great. That way I will be able to come and mic you so everyone can hear you. Also, if you're looking for the restroom, it's just right out this door. And then, like I said, if you have any questions, our presenter would be happy to answer them too. And we are so excited to have Sarah Moore here from the Alzheimer's Association to present to you tonight, Understanding Alzheimer's and Dementia. Thank you all.
Thank you. Well, good evening. Thank you so much for coming. This is a wonderful presentation by the Alzheimer's Association, and they have been putting this program together and delivering it for the past few years. It's very current and up to date, but it's my first time presenting this solo, so forgive me if I stumble, and please raise your hand if you have any questions, and we'll try to address those as we go or at the end. But before we get started, I just wanted to kind of get an idea of who our audience is. I'll introduce myself. I'm Sarah Moore. I have over 30 years in healthcare. I started in healthcare as a CNA and an activity director, and now I'm the director of business development for a home care company here in Schaumburg called Synergy Home Care. I've been an Alzheimer's Association volunteer since the early 90s when my grandmother was diagnosed with Alzheimer's disease. She lived in a long-term care facility in the end of her journey with Alzheimer's, but we cared for her at home for several years prior to that. And currently I'm taking care of and assisting in the care of several family members that have dementia. So I work in the field, and I'm also impacted at home personally, and I'm assuming many of you who are here today have similar experiences where you're impacted. So how many of you are currently living with Alzheimer's disease in your life somewhere? You know a person, or you're caring for a person, or even you are a person who has a diagnosis. Yeah. So everybody here almost has a personal experience, well, or has had a personal experience. Thank you, thank you. So in this program today, we're going to be comparing Alzheimer's disease and dementia. We're going to learn how to recognize how Alzheimer's disease affects the brain. We're going to talk about the risk factors. We're going to talk about stages of the disease and talk about the research that's going on right now and the advancements in Alzheimer's research. And we're going to talk about some resources that you can utilize with the association and beyond. So, oh, there we go. Pardon me while I pull up my notes here. So, in terms of the impact of Alzheimer's disease, you know, really it's a global crisis. We're at global crisis levels. Have you heard the term silver tsunami? Yeah, some of you have. You know, this is the baby boomers all kind of reaching, aging at the same time. And as you'll learn in this program, you know, Alzheimer's disease is a very common disease that we're dealing with as people age. Oops. So let's test our knowledge a little bit. I'll quiz you a bit here. How many people, well, there we go. Worldwide, how many people do you think are living with Alzheimer's disease? Any guesses?
I would say about 11 million.
About 11 million? Yeah. Anybody else have a? Worldwide, it's an estimated 55 million people living with dementia. Americans living with Alzheimer's, 6 million. I mean, it's a huge number. It's projected to reach 13 million by 2050, which is kind of staggering. And these statistics come from Alzheimer's disease facts and figures. It's an annual report that's available on the Alzheimer's Association website. So it's very current information. Okay. let's see, so 6 million living with Alzheimer's. And then we talked about how many Americans, we didn't talk about, sorry, I gave you the answer to another question here. How many Americans provide unpaid care for people who are living with Alzheimer's and dementia? And how many of you are providing unpaid care? Anyone here? I am, yeah. So currently there are more than 11 million Americans that are providing unpaid care for people living with Alzheimer's and dementia. I want to share a video here. I click through. We talked about the costs increasing. This is a huge impact on our healthcare system, for sure. We'll be talking a little bit more about how women are more impacted. And we'll talk a little bit about why to get a diagnosis. It's a tough thing to think about. Some people want to opt out and not know, but we'll talk about the reasons to get a diagnosis and get it early. And you can go to the Alzheimer's Association to learn more. There's quite a bit of wonderful information on their website. So let's talk about some myths and facts associated with Alzheimer's and dementia. And you've heard those terms kind of used interchangeably, and I'll talk a little bit about the difference, okay? They're related, but they are different, and we're gonna talk about both and how they're connected. Let's test our knowledge a little bit, and true or false, Alzheimer's is a normal part of the aging process. False, yeah, it's a common part, unfortunately, of the aging process. It's a very commonly diagnosed disease as people age, but it's not normal to have memory loss as we age. That is caused by a disease process. And different disease processes cause different types of impairment, and we'll kind of break that down a little bit. Okay. True or false, people younger than age 65 can get Alzheimer's. Is that true or false? Sadly, it's true. It is true. I've taken care of people in their 40s who have Alzheimer's disease, unfortunately. And while it's rare, it does happen. And again, if a young person is having symptoms of dementia, it's really important for them to get an early intervention. So let's hear from an expert. This is Dr. Snyder.
For an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy body, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain, or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So let's talk about that umbrella term. Dementia, just like cancer, is an umbrella term. There are different kinds of cancer. There are different kinds of dementia. The most common is Alzheimer's disease. Number 2 is vascular. Does anyone know what that means? Have you heard that term before? So vascular dementia is what occurs when a person has a stroke. So remember, with a stroke, there are blockages in the brain, and they're in the blood, the veins and the arteries, rather, in the brain that are carrying blood through the brain. A stroke is a blockage. It can be a small blockage or a big blockage. And that can be that poor vascular health that causes small strokes in the brain can lead to vascular dementia. Lewy body dementia, has anyone heard of that? Yeah.
My stepmother had Lewy body dementia.
Okay.
Or dementia or whatever.
A dementia with Lewy bodies is another way it's referred to. Yeah. It's often associated also with people who have Parkinson's disease. It can be a common dementia. That, some of the symptoms are very similar to Parkinson's disease and or related. Now, that doesn't mean that everyone with Parkinson's disease is going to get Lewy body dementia, but there's definitely some overlap there. People with Lewy body dementia often have problems and challenges with physicality. Their gait changes, they'll shuffle their feet. Frontal temporal dementia. Has anyone heard of that?
Doesn't Bruce Willis have?
Bruce Willis, yeah. So you might remember his first diagnosis was primary progressive aphasia, or PPA. And that is one of those first symptoms that shows with frontal temporal dementia. The brain is pretty small, really. It's about the size of 2 hands. And your frontal lobe is in the front. Your temporal lobe is here by the side in your temples. And frontal temporal dementia affects that part of the brain. This is the part of the brain that affects personality, reasoning. It also affects your filter a little bit. My stepmother has frontal temporal dementia. And for her, she had some positive personality changes, and that can occur with dementia. Not all the symptoms are necessarily negative in nature. Some can be quite positive. I'll share a kind of a sweet story. When she was in the hospital, we always had a little bit of an adversarial relationship because she's my stepmom, as we're supposed to perhaps. But when we were in the hospital with her, she wanted to make sure that everyone knew that I was someone who was an expert in dementia, and called me her sister in front of the nurse, said, "You listen to whatever my sister does." And it's just sort of a sweet example of how her personality changed, and she became very sort of friendly and jovial, and that doesn't always occur, but for her it did. Huntington's disease, there are mixed dementias. I see a lot of mixed dementia. I think it's very unusual for people to not have a mixed dementia. People with Alzheimer's disease often have poor vascular health, so it's very common for people with Alzheimer's to have small strokes throughout the course of their journey. And we'll talk a little bit about vascular health and how it impacts Alzheimer's disease. Let me move forward here. So the types of dementia, we talked about that. Okay, why is getting an accurate diagnosis important? Let's listen to Gail.
The diagnosis of Lewy body was helpful in our planning because we began to understand where this was coming from in the brain, where otherwise we would not have known. Like we knew something was happening, but what was it? To give it a label actually helped, although it was a big umbrella. It explains some of the characteristics and symptoms that we were experiencing and seeing.
I think it's also important for a number of reasons. One is to help others around you understand what your needs might be. The needs of a person with vascular dementia are very different than a person with an Alzheimer's type dementia sometimes. A good example might be people with vascular dementia don't always have memory loss. They might have confusion, they might have forgetfulness, they might have other physical symptoms due to their vascular dementia. But unlike a person with Alzheimer's disease, if they don't have short-term memory loss, you can't use the techniques techniques that we use for a person with Alzheimer's disease in terms of redirection or therapeutic fibbing, or some of the gentle techniques that we use for people with Alzheimer's. We don't get that reset that we do with Alzheimer's, where 5 minutes later we get to start over again, and that can be a kind of a wonderful thing. People with vascular dementia will know, perhaps, if you're trying to pull the wool over their eyes, so to speak. So if that person is, for example, saying, I want to go home, I want to go home, you can't say to them, well, your daughter's at work and she'll be in later. If that's not true, they might know, and you can't use those same therapeutic techniques. The other thing I want to mention about early diagnosis is there are treatments, there are medications that work if you use them early. And those same treatments and medications that work for Alzheimer's disease don't necessarily work with other types of dementia. A person with a Lewy body dementia, for example, might have a really strong reaction to those medications that we give people with Alzheimer's disease. Now, how do they make the diagnosis? We'll talk a little bit about that too, and it really is often just a process of elimination. So dementia is this general term for a collection of symptoms that are severe enough to interfere with everyday life. Alzheimer's is the most common type of dementia, and it's not a normal part of aging. It is a progressive brain disease. Okay, Alzheimer's in the brain. Let's hear from another expert.
Years ago, Dr. Alzheimer described specific changes in the brain, what we now call the formation of plaques and tangles. Alzheimer's is a progressive brain disease that's marked by these key changes and impacts memory, thinking, and behavior. The brain has three main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. Alzheimer's disease causes nerve cells to die, which leads to brain tissue loss and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's, such as memory loss, behavioral issues, problems with thinking, planning, and at the end stage, swallowing.
Yeah, and that's important to note. You know, you hear about people who die with Alzheimer's disease. We don't hear a lot about people who die from Alzheimer's disease. Alzheimer's disease isn't necessarily the thing that is life-limiting when a person has late-stage Alzheimer's disease. She mentioned swallowing. That can be a challenge with people with late-stage Alzheimer's disease. And then that general decline. But most people who pass away with Alzheimer's disease die from something else, whether it's a fall or pneumonia or an infection, but they're very vulnerable, of course. So she's also talking about, you know, that impact of diagnosis. Getting that diagnosis early can really make a difference in your success in coping with your dementia, regardless of the type of dementia that we're talking about. So Dr. Alzheimer's, when he discovered Alzheimer's disease, he saw these plaques and tangles in the brain. And just to describe that a little bit for you, the neurons in the brain, they have these kind of fingers that reach out to connect to each other so they can speak to each other. And the plaques in between those fibers and make it hard for things to communicate, and then they get all twisted at the end and tangly. So, you know, where your brain is telling my hand to click this little clicker, if the plaques and tangles are in the way between my neurons, the message isn't going to get there from my brain to the action I need to take. So instead of, you know, brushing my teeth, I grab the hairbrush or the razor, or, you know, there's a lot of miscommunication going on in the brain related to those plaques and tangles. Some of the medications that we utilize help eliminate those plaques, and they slow down those tangles from occurring. And just some images here of the brain. So it was 100 years ago that we started noticing these. And back in the day, they used to call this senility, right? And everyone was kind of lumped into one category. Now we know there are over 100 different kinds of dementia. Some types of dementia are temporary as well, and some are permanent. So, you know, Alzheimer's disease, vascular dementia, the ones that we discussed, most of those are permanent dementias that are, you know, a person with those dementias will have decline over time. But you can have a temporary dementia related to being dehydrated or poor nutrition, so that's another reason why it's really important to go to the doctor so they can make sure that there isn't something simple going on that can be treated. Vitamin deficiencies are another example. So really, it can be a scary thing to get diagnosed, but if you can get that early intervention, you're going to just do so much better, and there's a possibility that we can reverse some of that. Okay, risk factors. We'll test our knowledge here again. What is the greatest known risk factor for Alzheimer's disease? We kind of talked about this. What do you think? A lot of people think it's family history, and that can be a really scary thing, right? When you have a family history of Alzheimer's disease. Yes?
But it also says genetics, but I mean.
What's the difference? Yeah.
My step-cousin has Alzheimer's.
Do
you see what I'm saying?
Yeah, I mean, there is a genetic component, and there is a family history component, but it's minimal compared to the real risk factor, which is aging. Yeah, and so don't be too scared or afraid if you have a loved one. You know, think about this too. Think about the medical changes. Think about the dietary changes. Think about all the different things that we do medically now that we didn't do 40, 50 years ago. Taking care of your vascular health is really the best thing that you can do to prevent dementia and Alzheimer's disease. And doing that as we age, but the older we get, the more likely it is that we will develop a dementia. So again, it's not a normal part of aging, but after age 65, the Alzheimer's risk doubles every 5 years. 34% of people over age 85 have Alzheimer's. That's how common it is. Okay, we've got another expert.
Alzheimer's disease is marked by specific brain changes that result in clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning, and ultimately Alzheimer's is real. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are two categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease, but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
So she mentioned that there is a type of Alzheimer's that can be determined when you're quite young. It's based on genetic testing. It's often diagnosed when people are under age 65, that type of Alzheimer's disease. And there is actually a spinal test, a spinal tap related test that they can use to see if you carry that genetic component. If you do have a family history, that's an option. It can lead to certainly early intervention. And there is genetic testing available. It's not always covered by insurance and certainly not by Medicare. So that's the other challenge. It's something to ask your doctor about, but it's not always available covered by Medicare. Okay, let's talk about some high-risk groups too. Black Americans are twice as likely as white Americans to have Alzheimer's or another dementia. And Hispanic Americans are 1.5 times as likely to have the disease as white Americans. And almost 2/3 of Americans living with Alzheimer's are women. So let's start at the bottom. Why are women getting Alzheimer's more than men? Does anyone know why? They live longer. They live longer, and we've learned the longer you live, the more likely you are to develop a dementia. So that's one of the reasons. In terms of why Black Americans and Hispanic Americans, there's a higher risk of vascular disease in those populations, but there's also questions about access to health care, early intervention, and diagnosis that puts those populations at higher risk. So risk factors, age. We can't help it. We're all getting older, but the disease is more prevalent in a population that's over 65. Family history is a known risk factor too, so if you have a parent or sibling with the disease, it does increase your risk. But it also can let you do some early interventions in terms of diet and exercise and heart health and vascular health. Risk genes and deterministic genes are the two types of genes associated with Alzheimer's, and we talked about certain populations are at higher risk. So the stages of Alzheimer's disease. Before we talk about stages, I always like to say people with Alzheimer's disease, they don't read the book on what stage, you know, so it's kind of an all over the place. It's not a perfect science. We're gonna learn from a few people who are living with dementia what that looks like for them.
With an overachiever, and when you're unable to deliver or you're not performing at the same pace that you once did before, that's frustrating. It's frustrating to not know where you place things. It's frustrating to not be able to explain to someone in a way. It's frustrating to read something and you forgot what you read. It's frustrating to continuously have to change your password and you just changed it last week and you're constantly doing the same thing over and over again.
So that's, you know, it is a challenge when you're a young person coping with Alzheimer's disease. Let's hear from Phil.
I stare at it. It's crazy, but numbers I can't deal with it anymore. And in some ways, that's the disease to me. Increasing words, which tough words my entire life. You know, as an avid reader, as a reporter, as a writer. I struggle with them now.
I think the thing that surprises me the most about my dementia
Can you hear it okay?
is that it is progressive. And I'm finding that I'm forgetting.
I have to get out of your PowerPoint to change it, so I don't want to do that. Okay.
And, so that becomes a little
Some are
bit
better than
sometimes,
others. Yeah.
to see my cognitive impairment decline. But again, I really have hope. I don't live really in the future. I can't live in the future. I can't worry about what the future is going to bring. I have to live for today.
We're just going to adjust the volume real quick. Sorry about that, everybody. We'll try that. Okay. Thank you. Thanks, everybody. Okay, so the stages. When you first are experiencing symptoms and you're going to the doctor, the first thing they're going to diagnose you with is a mild cognitive impairment. Kind of skipping to that yellow slide there. A mild cognitive impairment. And I'll share a story, my stepmother. So she, when she had her diagnosis, lived in that space of having a mild cognitive impairment for several years, where we knew she was having some struggles, but it was not disruptive to her life. She was still working. She was still driving. People with MCI or a mild cognitive impairment, you might not even know if you spent 15, 30 minutes with them that they have an impairment. But when they start to show signs, when people around them start to notice, that's when we're in the mild category. You know, we're having some symptoms that are popping up. And that's something I tell people, you know, certainly if you're noticing that you're experiencing a deficit, go to the doctor, get a baseline neuropsych eval, get a baseline reading. And perhaps you're asymptomatic at that point. Maybe you're only having just mild cognitive impairment symptoms. That's the time when you can start taking those medications that are really impactful to Alzheimer's disease. That's the time when you can change your diet and exercise to really stay healthy. So for my stepmom, she also has diabetes. So her mild cognitive impairment, once we started to treat her diabetes, she started to do quite well for several years. And again, you can have some impact there. Then you're progressing into mild, moderate, severe. Moderate, you're not able to work with moderate dementia. You might need some assistance with your activities of daily living, brushing your teeth, getting into the shower, feeding yourself. It might start to get confusing, where you're maybe having difficulty with the utensils, or you're losing your appetite, and you don't have a willingness to eat or a desire to eat. And then when we get into the severe category, then we're really probably not walking anymore. We're not able to feed ourselves anymore. Someone needs to feed us. We might not be able to walk without assistance. We might not be able to walk at all. We might be bedbound, and we're going to progress to that. Now, with an Alzheimer's type dementia, you'll see a slow decline. Whereas with a vascular type of dementia, a person will stay going, you know, kind of at this level, doing well for a while until they have a vascular incident like a stroke, and then they have a step down. So that's another way when we talk about the history, that when we take that family history, we look for how is that person declining? Did they have sudden changes in cognition, or has it been slowly progressing? That can tell us a lot about the type of dementia they have. So 3 broad phases. There's asymptomatic, mild cognitive impairment, and then there's your dementia sector. And then in the dementia phase, you've got your 3 stages, mild, moderate, and severe. And you'll hear people talk about 7 stages. You'll hear people say, my mom has stage 4 dementia. That's, you know, people hear things and say things about the stages. I think it really doesn't matter as much as what matters is not what stage of dementia you're in, but what are your symptoms, and are they being managed well? Are you comfortable with your symptom management, or do you need greater levels of intervention? No 2 individuals experience symptoms the same. People kind of bounce back and forth between phases, and symptoms worsen over time. People progress through the stages at different rates. 3 years, 10 years, everybody's different. Treatments. There are some really exciting treatments that just came out in 2023. These are amyloid. Remember I talked about the plaques? These are medications that work on those plaques, and they keep them from forming, which is really exciting research development that's happened with medications. They're not available to everyone. Medicare doesn't necessarily cover them for everyone, but they are starting to become more available in trials and things like that. And we'll talk about trials too. But Aricept and Namenda are the two big names that people will mention, and they have usually about 2 years of a lifespan that they'll be effective during. After that, they're kind of helping a person maybe maintain where they are, but they're not going to completely slow down the disease or stop the disease. They're just going to slow it down. And it's often very expensive, those medications. So some people opt to take medications and some people opt not to. And that's, again, a choice about treatments. And people should talk to their doctor about which treatment would be best for them. There aren't any medications that cure Alzheimer's. But there are medications and treatments that change the disease progression. And then there are drug and non-pharmaceutical options that can help treat symptoms like the memory loss and confusion. If someone has depression, if someone has anxiety in conjunction with their Alzheimer's disease, that's something that we can really make an impact on. And there are medications that can treat those symptoms as well. There are patches, there are pills, so if a person's not able to take a pill, they can use a patch. There are intravenous medications, there's infusion treatments, and they work in varying degrees, and they don't work for everyone, and they're not effective for everyone. Sometimes people will try those treatments and they won't have success. Sometimes they will. So it's really a process of kind of experimentation. You should go to your primary care physician if you're having some concerns, but they will recommend then that you go to a neurologist as well, usually, to get what's called a neuropsych eval, which takes somewhere between 4 and 6 hours and is done in the neurologist's office. Usually there's a team approach. Your family might be involved in that in terms of talking to the doctor and expressing what changes have been going on. We encourage people to take someone with you when you go to the neurologist so they can help you with questions, they can be an advocate for you, and especially if you're having memory challenges, they can be a person that will help you communicate to your family or remember what the doctor talked about. And that's really important to have that advocacy. Okay, research. We'll hear from a few of these. I'm going to play a couple.
Exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease as a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point, and when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories. Growing evidence indicates that people can reduce their risk of cognitive decline by adopting key lifestyle habits. More and more research shows that factors like exercise, nutrition, and aggressive management of cardiovascular risk factors may impact our ability to slow cognitive decline as we age. And through current studies, we're exploring how certain lifestyle factors reduce the risk of developing Alzheimer's and dementia.
And the lifestyle factors that they're talking about are the same thing your doctor is always talking about, right? Which is what? Exercise, watch your diet, right? We're watching what's the word I'm looking for? We're watching our triglycerides. We're watching our HDL, moving, keeping active. You might have heard that learning something new, and the library is great at helping with that. Learning something new, learning a new skill. People will often ask me, we've heard that crossword puzzles are helpful. Well, crossword puzzles are helpful if you don't normally do crossword puzzles. But if you do crossword puzzles every day, keeping doing them is great, but try something new. Learn a new language. Learn a dance move, you know? What was that?
An instrument.
Learn an instrument, yeah, absolutely. Anything that stretches your brain and exercises your brain is really impactful, and you can make a difference. I'm going to skip these two. So clinical studies. The Alzheimer's Association has a program called Trial Match, and various clinical studies that are being done all over the country, but in Illinois, we're very near Chicago, and we also have some neurologists even here in the suburbs that do wonderful clinical trials. So if you reach out to the Alzheimer's Association, you can learn more about those.
Everyone can get involved in a very direct way in the fight against Alzheimer's disease. And for people who currently have dementia or Alzheimer's disease, there are some additional benefits. You get access to very close medical care. You also may be one of the first people to have access to the treatments that will eventually prove to work.
You might hear the phrase negative trial, which means it didn't hit the envelope. It didn't result in an FDA-approved treatment for the disease. But I think the only negative trial is one that doesn't provide us with valuable information. If the trial is well designed and is a good scientific experiment, we can get extremely valuable data that can help plan the next trial and make it even better than the last. And it gets you that much closer to that FDA-approved drug, to that effective treatment, and maybe someday even prevention.
And that's the thing, we need people to participate in these trials. Even people who don't have a dementia diagnosis, people who are family members of a person with dementia, people who are caretakers or care partners. I love that word care partner, by the way. That's something that I heard recently instead of caregiver. You know, because really when you're first diagnosed with dementia, your care partner might not be providing care for you directly. They're just a supportive person. And then as the disease progresses, they might become more involved in your care. So I love that term, care partner. I think it really expresses that journey piece of Alzheimer's disease. Okay, let's see.
Participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
And those trials can be great. They can, you know, be using those new medications, medications that aren't even out in the market yet. And I've taken care of a number of people who've had great success being in trials. So, advancing Alzheimer's research. We've increased our understanding of Alzheimer's significantly over the past decade, and the Alzheimer's Association is a big piece of that, a big part of that. People living with dementia, their caretakers, their care partners, and healthy volunteers without dementia are needed in these clinical studies. Both pharmaceutical and non-pharmaceutical studies are taking place across the country and online, and you can go to alz.org/trialmatch to learn more. And the Alzheimer's Association, what can the Alzheimer's Association do for you? They're all over the country. We're in every state. The best part of the Alzheimer's Association, I think, is the 24-hour hotline. But we're leading the way to end Alzheimer's and dementia. We are accelerating global research. We're driving risk reduction, early detection, and we're really supportive and caring to those care partners. The 24-hour hotline is available 24/7. It's manned by volunteers that are really wonderful at what they do. And I tell care partners all the time, they can call at 2 in the morning when they're having a catastrophic crisis with their loved one who has dementia. It can happen. So please know that they're there for you. And there's some cards on the table there that have that phone number on the back, the 10, I think someone grabbed one, the 10 signs of, yeah, that piece, that bookmark piece. It's fantastic. And there's other brochures over there that can help you too. This is an attorney at law that we work with, Peck Ritchie. There are others. You can actually go to the Alzheimer's Association website. There's a portal there where you can, it's sponsored by the AARP, and it's a resource network, and you can look up communities, you can look up home care providers, you can look up legal experts. That's all listed there on the Alzheimer's Association website.
I've had a couple of phone calls to the call center. I've had a couple of quick questions that I wanted to ask. You know, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I'm struggling dealing with them, and it's amazing. It's one of the best things I ever did was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
And we even give that number to our caregivers at the company I work for. You know, taking care of people with dementia professionally or otherwise is challenging. And even professional caregivers need support, and they can use the hotline.
I went to the Alzheimer's Association website, which is alz.org. Then I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has it been, how many people are affected by this, where can I go for resources, where can I go for help, what do I do with this, how can I handle this, is there more people like me out there, is there someone that I can talk to if I need to? And there I found the support line is 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
I'm going to skip a couple of these just because we're getting short on time. Let's talk real quick, though, about some of the ways that you can join the fight. One is the Walk to End Alzheimer's. That's a really big piece. And we always need volunteers for the walk. Volunteers run our hotline. Volunteers do what I do. Volunteers facilitate support groups. We also have an advocacy section on the website, so if you're interested in learning about what bills are being introduced into Congress that are related to Alzheimer's disease and you want to be informed about that, you can sign up for emails about advocacy. There's the trial match that we already talked about, the walk, and then the longest day that happens on the day that's summer solstice, I think it's June 22nd, and we use that as a fundraising day where it's the longest day of the year, and you know, when you're a caretaker for a person with Alzheimer's, every day feels like the longest day of the year, and that's why but there's some wonderful fundraisers related to that. Oh, I've kind of scanned through here. I should have been clicking. The Walk to End Alzheimer's, if you haven't attended, it's held in communities locally. Out here, we do it at Bussey Woods. I participated this year in St. Charles at Potawatomi Park. It's so exciting to be there with all those families that are impacted, and it's just a beautiful day. And we raised, I think they raised over $500,000 just at St. Charles this year. So they really do an extraordinary job. And that's the hotline number, and that's the website. And I'd love to answer any questions that you have. Yes?
A lot of people take like brain supplements.
Supplements?
Yeah, you see it on TV.
It's a great question.
These ads and
Yeah.
stuff. Does that?
Prevagen?
Prevagen is one, and there's a whole bunch of other ones. Do those help at all?
Talk to your doctor, for sure. Don't spend a lot of money on vitamins and supplements without talking to your doctor. Because if you need vitamins and supplements, there's more than just Prevagen out there, you know. Prevagen is, you know, they're selling that to try to make money on kind of that fear factor of, I mean, there's not any research necessarily that those medications work, but, you know, just like with any illness, when taken in conjunction with other medications, if your doctor's in the mix and knowing what you're taking, those things can help make a difference if they can treat your symptoms. I mean, they're not necessarily harmful, but they might not necessarily help.
Well, the reason I ask is you see so many commercials.
Yeah.
You know what I'm saying? And I'm here because my cousin, of course, she's like, oh, I'm fine, you know, I mean, but I just.
The better thing to do is really just focus on your general vascular health. Mm-hmm. Diet and exercise is much more impactful than any supplement. But I would only take supplements that are recommended by your physician. Mm-hmm. And just know that if you're seeing a commercial for it, that's someone trying to sell you something. And, you know, it's good to be cautious.
Okay.
Yeah, I mean, there's a lot of people that prey on people's fears related to Alzheimer's and dementia. So you have to be wary.
It's almost the same question as her, but I've been seeing.
Oh, microphone.
Yeah. I've been seeing a lot about this honey and some kind of seed that you're mixing on. I get about 5 of them on my face on all these holiday, Hollywood people that
Sure.
are saying it
Manuka honey.
5 days.
Coconut oil is another one we hear about.
It's a big thing now, man. So what do you think?
I think that if it makes you feel better, if, you know, I mean, those things aren't going to hurt you. Honey's not going to hurt you.
Right.
But, you know, I'll use an example. I have a good friend that has cancer. She's doing all the things her doctor told her to do, or chemo or surgery and all, but she's also taking all these supplements. Yeah. And they help her feel better, and they're not hurting her, and her doctor knows about it, and what's the harm? You know, just don't let anyone take advantage of you. Yeah, absolutely. You don't need to spend needless amounts of money on magic honey from
Exactly.
somewhere. It's probably, if magic honey fixed it, I wouldn't be here today. So, any other questions?
I just want to reiterate what you said, you know, go to your healthcare professional. Talk to them about anything you happen to see on TV, or, I mean, most of the pharmaceutical commercials end with, talk to your doctor about this or that. You really do have to go back to the experts, because there's a lot of stuff out there. It's not going to hurt you, but it's not going to help you either.
Right.
To flip side of that, there's just an article published over the summer about a study done with lithium in rats that had developed a plaque, the amyloid plaque, that it actually reversed some of the amyloid plaque. Now, lithium is toxic in doses, so you have to be very careful about it, but it's one of the few natural ingredients that they said.
Well, your body makes lithium, actually.
Well, and you can consume it with nuts.
And it's in foods and things, yeah, absolutely. And, you know, again, there's with any serious illness, There are natural treatments, there are herbal remedies and things to explore, but I would just always take that with a grain of salt and know that people are trying to sell you something.
So salt is good as well?
Right, exactly. And see your doctor, talk to your doctor. Don't trust the web forums, don't trust your neighbor. Trust your doctor.
With all this social media and
Yeah.
TikTok and stuff, it's
Sure.
amazing what's out there and people believe, and then they start telling everybody about it, and it's like,
Well, that's a whole nother meeting, but yeah, absolutely. We're all seeing those AI-produced videos on TikTok that promise us this and that, and we should be wary, yes. Well, thank you, everybody. I will remain here for a little bit if anyone has any questions. My card is out on the table, too. If I can be a resource to you, please reach out to me. I'm happy to help. And I thank you so much for coming tonight. Thank you.
Thank you so much, Sarah, and the Alzheimer's Association, everybody.
Yeah.